Hello everyone, and welcome to Clarteis webinar. Today we will talk about Exciplex, the new solution treatment for autoimmune skin conditions such as vitiligo, psoriasis, and alopecia areata. Exciplex has been developed by Clarteis in France 3 years ago. Today, more than 30,000 treatments have been done all over the world. We have 2 clinical studies already published, and we are conducting 2 more clinical studies. We are delighted to have with us today Dr. Amira Gamal from Egypt. She is a dermatologist with more than 15 years of experience in clinical dermatology. She is an expert in the treatment of autoimmune skin conditions, and she will share with you her expertise and will explain to you how Exciplex made her dermatology practice complete. Of course, a recorded version of this presentation will be available very soon in the next few days. Of course, we will share it with you. And at the end of this presentation, Dr. Amira and myself will be very happy to answer all your questions. So please type your questions during the presentation, and at the end, we will answer all of it. Thank you so much and enjoy the presentation. Dr. Amira, the stage is yours. Thank you.
Good morning. This is Dr. Amira Gamal. I am a dermatology consultant. Today we will talk about the efficacy and safety of Exciplex in treatment of some of autoimmune diseases like vitiligo, psoriasis, and alopecia areata. First, we will talk about the monochromatic excimer light. What is the monochromatic excimer light? This is a type of form of target phototherapy device which emits a single 308 nanometer wavelength. This excimer light, it comes either from lamp or excimer laser. Many studies compare between the excimer lamp and laser, and they conclude that both have the same clinical efficacy, but the excimer lamp is less costly, easier to use, and take less space occupied. The 308 nanometer excimer light can be widely used in many skin diseases, including vitiligo, psoriasis, alopecia areata, a lot of hypopigmented disorder, cutaneous T-cell lymphoma, lymphoproliferative diseases, granuloma annular, Langerhans cell histiocytosis, lichen planus, localized scleroderma, eczema, and a lot of diseases. Excimer light is very efficient treatment with minimal side effects. Today, because of our time, we will focus on the excimer light rule in vitiligo, alopecia areata, and psoriasis, and we will share our protocol and our clinical results. We will talk about the efficacy, regarding the efficacy and the patient acceptability and safety of the excimer light. Generally, the general mechanism of action of excimer light is by induction of T-cell apoptosis, by local immune suppression, by local immunomodulation, and it inhibits epidermal keratinocyte hyperproliferation in case of psoriasis. Also, it stimulates the prefollicular DOPA-depleted amylotic melanocyte to produce melanin in case of vitiligo and hypopigmented disease. Monochromatic excimer laser and narrowband UVB, they both are phototherapy for autoimmune disease. That's why they make many studies to compare between the effect of excimer light and UVB narrowband. The conclusion was that the excimer light 308 nanometer is the best wavelength to target the T lymphocytes. It increased the induction of the T-cell apoptosis more than the narrowband UVB. So it requires less number of sessions for faster results. And according to that, to achieve the improvement, it takes less sessions than the narrowband. And in order to that, the whole accumulative dose will be lesser in excimer light more than the narrowband. So we are reducing the risk of skin cancer. Also, the excimer light targets the area which is difficult to be reached and protect the other healthy skin. Okay. This is the advantage of excimer light versus the narrowband UVB. Okay. I'm using the Excimer light, the Exciplex, for more than 2 years now. It's very easy to use because of its shape. It has a big spot size, allowing me to do a large area in short time. The light, it's light in weight, it's less than 1 kilo, so it's very easy to handle it when I'm using it. It also has different spot shapes, which make it easy to reach what area I want and to target the area I want. Okay, we will start first with vitiligo. Excimer light is the first line of treatment now in vitiligo. This is my opinion. Okay, efficacy of the Excimer light depend on the area. The excellent improvement will come in face and neck. The slow response will be in the extremities. The duration of vitiligo, if it's old or recent. The Excimer light increases the apoptosis by making a breakage of DNA chain that cause decrease of lymphocyte proliferation. By acting as immune suppressant, immunomodulatory, Excimer light increase the just will increase the melanocyte proliferation, increase the melanocyte migration from the outer root sheath of hair follicles, from the melanocytes in the margin of the lesion, and also from the residual intralesional melanocyte to repopulate in the vitiligo area. So it increases the melanocyte proliferation and migration from this area. Okay, this is our protocol in treatment of vitiligo with the Exciplex or the Excimer light. Actually, for the beginners, I recommend to use the MED. This is an automatic option in the device to make to choose the ideal dose to start with. It is the minimal erythema dose. According to our protocol, the session frequency will be 2 to 3 times per week. The vitiligo treatment, like we need like 20 to 30 sessions. We decrease the dose in children because they are sensitive skin. In acral and very resistant cases, we make a combination with fractional laser and microneedling, which give faster results. Also, we make a combination with tacrolimus 0.1%, which give also a faster result, especially in acral and resistant cases. Okay, now we will come to our clinical results in our clinic. This is a child which is 5 years old. She has this vitiligo patches 2 years ago, and it didn't respond to any of other treatment. As you see, this is the difference between before and after 15th session. Disappeared totally, the patch. It repigmented again. It started to repigment sure before 15th session, but it disappeared after the 15th session. This is another case. This is a young man. He has this patch for 1 year ago, and we start with him only by Exciplex monotherapy. It repigment after, or started to repigment after 7 sessions. As we see the difference between before and after sessions with Excimer light. This is a child. He has 6 years old. He has this patch 1.5 years now ago. This is only after 7 sessions. It disappeared totally, actually, and I start a maintenance after that. After the 7 sessions, I didn't continue the other sessions. As we see, faster improvement in face and neck patient. This is a child. She has a patch in her back of neck, and this is after also 15 sessions. It starts to repigment, and actually it's totally disappear now. This is the same child. As we see how it was a milky white hypopigmented patch, and this is after the 15th session. As you see how it repigment again, and also this is Exciplex only, or the Excimer light only without combination. And this is also after 15 session. You can see her underarm. This is amazing case because this is my old patient. She has this patch 3.5 years ago, and she didn't improve even with me with the local treatment. When I started the Exciplex with her, or the Excimer light with her, actually I started to have a result from the 2nd session. This was amazing even for her. And it disappeared totally after 12 session. Okay, this is, as we said, in acral and resistant vitiligo patches, I make a combination between the Exciplex and fractional laser or microneedling, and I apply the tacrolimus at the end. If it's very resistant case or acral case, I make 2 sessions per week, 1 session with the fractional laser and the other session with the microneedling. If it is a sensitive skin or not a very old lesion, I make only 1 session per week fractional laser. I start with the excimer light, then I do the fractional laser or microneedling, then I apply the tacrolimus in a very fast way. This is the resistant cases of vitiligo in my clinic. This patient, I started with her 5 sessions of excimer light, but I didn't see the improvement. So I started the combination with her, and this is after 10 sessions. You can all see the difference when this is the batches started, and some of these batches start to disappear totally after 10 sessions. It was very resistant case. This is another case of resistance. This is after only 8 sessions. It repigment again. This patient, she has vitiligo all over her face, but actually I only get this area because of the privacy of the patient. She has, you can see the line between the vitiligo skin and the normal skin. This is after only 11 sessions, twice per week, and it almost disappear or repigmented again the vitiligo area. You can see here the difference between the two line between normal and the hyperpigmented patch, and here the line disappear. It's in all her face. Okay. Okay. Now we will go to psoriasis. Psoriasis, it's a complex immune-mediated skin disease propagated by abnormal interaction between T lymphocytes, keratinocytes, dendritic cells, neutrophils, and cytokines. Innate immune cells produce cytokines, which activate the myeloid dendritic cells, make a pro-inflammatory which activate the myeloid and dendritic cell, which produce antigen and secrete some mediators, which make a differentiation of T17 and T1. Also, the T cell will activate the keratinocytes to produce pro-inflammatory peptide and cytokine. This is all will make a positive or create something called positive feedback loop, which activate or make the activation of the psoriatic disease cycle. Decrease of keratinocyte maturation and increase the keratinocyte proliferation and the vascular dilatation. This is the activation of the psoriatic patches. The excimer light here will induce apoptosis in both keratinocytes and T lymphocytes. This is by the absorption of photons of 308 nanometer wavelengths, which induce, as we said before, DNA breakage, leading to what's called cell arrest, cell cycle arrest, which breaks the positive feedback loop we talk about and stop the disease activation. Also, high doses, but this is in psoriasis only, high doses of excimer light reduce the number of pathogenic memory T cells which infiltrate both dermis and epidermis of the psoriatic lesion. Okay, clinical studies show that 84% of patients achieving more than 75 improvement in less than 10 sessions. And actually, this has happened with me. In psoriatic patients, I see the improvement from the second or third session. It's currently indicated for adult and pediatric patients with mild and moderate psoriasis, less than 10% of body surface area. Also, excimer light has been shown to be effective in treatment, in combination treatment, either with topical or systemic treatment in case of severe cases. Okay, for the clinical protocols for the psoriasis, as I said, for the beginner, we should make the MED. The MED will be different according to the skin phototype, actually, but it will help you to choose the ideal dose which you start with. The session frequency of session in case of psoriasis is 2 times per week. Psoriasis treatment, it needs like 15 to 20 sessions. Home treatment for me, I give tacrolimus. It's very fast improvement from the first session, as we said before. Okay, let's go to our clinical result, especially in the I choose the resistant cases. This case, young woman, she has psoriasis for 10 years and with no improvement, actually, with a lot of treatment every day for 10 years, but no improvement, just relapse very fast. This patient before and this is after 13 sessions, we can see the difference in the scales, the patch, the dryness, the color of the skin, everywhere. This is the same patient. She has a very big batch and very difficult batch of psoriasis here. Now, after 13 sessions, her leg, as you see. This is amazing case, and I love Excimer Light in case of scalp psoriasis. We know that scalp psoriasis, it's almost 80% of the psoriatic patient has scalp psoriasis. It's very annoying, especially for the female, and especially if it's come in the hairline in front. This is after improvement after only 4 sessions. Give very good, very excellent improvement in case of scalp psoriasis in few sessions. The patient, this is before and this is after 4 sessions, but actually she get improved after the 2nd session. But this is totally disappear the flakes after 4 sessions. Okay, this is one of the severest cases I have seen. This patient has psoriasis for more than 25 years ago. She told me literally that she forgot how her foot looks like normally. This is after only 10 sessions with a very minimal home treatment. She took only 10 minutes, 10 sessions, and now she become like that. And actually now she is more improved than this. Okay, now we will talk about alopecia areata. Alopecia areata is an autoimmune condition characterized by T-cell mediated attack of the hair follicle. T-cell lymphocytes here have a critical role in pathogenesis. That's why the Excimer Light is excellent choice for treatment in hair regrowth. By its immunosuppressive and immunomodulatory photological action, it involves with the withdrawal of Langerhans cells and decrease their antigen presentation function and increase the apoptosis, which gives a chance for the hair to regrow another time in fast result. In alopecia areata, takes a few sessions, session up to twice per week. Sometimes for me, I make only once per week session. It takes about 10 to 15 sessions only. It can be a monotherapy. It's safe, painless. You can use it in children. It's very fast session. It doesn't take any time. Faster improvement. It come with if you make a combination of other treatments like local treatment. Okay, this is a case of alopecia areata, and as you see how it improved after only 7 sessions with a minimal home treatment. As sessions, I only use Excimer Light. I didn't use anything with it, and this is only after 7 sessions, once per week. This is 1 session per week. Okay, our conclusion here. The efficacy of Excimer Light is clinically proven for vitiligo, alopecia areata, and psoriasis. The 308 nanometer is the best wavelength that it can it can be absorbed fastly and target T lymphocytes fastly. So give us very fast results in short time and improve our choices with the patients in this autoimmune diseases. For me, it makes my life with my patients very more easy. So now I have many choices for the patient. I can give them the hope that they can be treated, especially the children, especially who have a psychological problems with the vitiligo, psoriasis, and the alopecia areata. It gives this support because I'm talking with my practice that I saw a very good improvement with this patient with the Excimer Light. It has the same efficacy with Excimer laser. It is faster response than narrowband. It's superior, of course, superior than the local treatment. It protects the healthy skin, so we decrease the risk of any skin cancer or any side effect. It's painless and safe, so I can use it in children. I can use it without time consumption. I can use it and let the patient go to work in the same day. It's okay. It doesn't take any time. At the end, I want to just to remind by something. When we finish my protocol, when I finish treating the patient, I use something called maintenance. This is very, very important. When I reach the achievement or the result I want, I start to withdraw my session. I don't stop it at once. I withdraw it and increase the space, the time between or interval between the sessions until I make it every 2 weeks for, oh sorry, every 2 months for 1 year. Then I will see the patient every 6 months to be sure that everything is okay, with no remission, with no reback of the disease again. And that's it. Thank you for your attention, and nice to meet you.
Thank you so much, Dr. Amira. So that is very interesting presentation, actually, and I hope that all doctors could hear it. Actually, we have some couple of questions that some doctors sent it to me while you were presenting. One of those questions are, the first is alopecia universalis. Do you treat your patient that have alopecia universalis with Excimer or with Exciplex?
It can be used. I have one patient, but it was combination treatment, not immunotherapy. I use it, but not immunotherapy, with other treatments.
Okay.
But it can be.
Okay. The other questions is regarding the maintenance sessions that you talked about it last at the end.
Okay.
So one doctor is asking, what about the risk of hyperpigmentation or erythema when it comes to maintenance sessions after 1 month or 1 month and a half?
No, we actually we didn't see this. Okay. Even if the skin is, you see that it become normal, it doesn't make hyperpigmentation. And if you see that it make more erythema, you can decrease the dose. It's okay if you see that it make erythema. But actually, in psoriatic patients, they tolerate this dose even after they improve. They still tolerate this dose. This can be only in vitiligo that you decrease the dose if you see that the skin start to make erythema.
Okay. Another question from Dr. Reem is for, just to read it, for ophiaziform alopecia areata. Did it give a good result?
What? For what?
Ophiaziform alopecia areata.
I didn't hear you.
It is written from Dr. Reem, ophiaziform.
Ophiaziform?
Yes.
No, I didn't use it in this. What's ophiaziform?
Please, Dr. Reem, can you explain more about this type of alopecia areata? Because we couldn't understand. Another questions from Ammar, Dr. Ammar, is about acral vitiligo. What is your solution regarding acral vitiligo?
Okay, as I told you, I have a lot of patients with acral vitiligo. I make the combination therapy. We said it is I make it twice per week session. One session, like for example Saturday and Wednesday. On Saturday I am making Exciplex, the Excimer light, then fractional laser, then tacrolimus. This is 3 steps. It will be in a very fast way because the channels will close, which I make with the fractional laser will close. So this is one session on Saturday. And Wednesday, the patient come back and I will make another session, but instead of fractional laser, I do microneedling. Okay. And in home, I am using with them some local treatment, as I said, tacrolimus, 0.1%, and some of the repigmented creams, like I don't know, I can say the cream I am using with the patient or what. It's okay.
Okay, and it is clear. So you, just to answer these questions in a simple way. So for acral vitiligo, you are combining Exciplex with laser CO2 with topical cream, topical treatment.
and the microneedling.
Okay, and how many sessions it needs to start to see the first results or to complete the result, to complete the treatment?
No, to see the result in acral patient, in acral vitiligo, it take like about 10 sessions. You will start to see the dots of the melanocytes start to repigment again. Then you will see the improvement according to the case, according to how old it is, like that.
Okay. Regarding Dr. Reem, she was asking about alopecia areata. She means the margins of hair. Margin of alopecia areata.
Okay. I used it in the margin of alopecia areata, in the margin of hair, and it gave us very good results. I have 2 patients like that.
Okay. And how many sessions? It's the same number of sessions? Because maybe
Yes.
it's more resistant.
10, 15 like that, yes.
15. Okay.
10, 15, yeah.
Okay. We have also questions about, in your experience, what is the role of tacrolimus?
As immunomodulatory, it gives us a very good treatment in home, and in the combination, when you make the fractional laser with the excimer light, it makes channels which allow the tacrolimus as immunomodulation to go very fast indeed to the target area.
Okay. We have also about, do you recommend what is the role of psoriasis in vitiligo? We know that psoriasis is more with UVA. We
Yes.
use it with UVA. What is the efficacy? Do you think that PUVA is efficient, or what is the difference between the PUVA and the excimer light?
I will tell you, PUVA can be efficient, okay, but the complication and side effect of PUVA is very, very high if you compare it with the excimer light, okay? The PUVA, you make 2 carcinogenic elements for the patient. The UVA itself and the psoriasis itself, it targets the DNA and makes some mutations. So you increase the risk of skin cancer for the patient. And also it has a lot of complication when you take a psoriasis. You need the patient to you don't allow the patient to go outside for like 48 hours or 24 hours. It makes a lot of sensitivity, food sensitivity. All of this we can't, it's not with the excimer light. It's very safe and no complication, no side effects, very easy to use. You decrease a lot the dose of accumulative dose, so you decrease a lot the risk of any complication or skin cancer.
Okay, we have questions also from a doctor from Asia. He is talking about microneedling. His question is, or her question, how about microneedling? Only needle, or also you put the drug?
Or I put what?
Drug, some cream or?
No, it's only needling, only by needle or by derma pen or derma ruler. It's just needling by needle, and you put the tacrolimus.
Okay.
We said tacrolimus, only tacrolimus.
Okay. Do we get erythema with aggravated psoriasis? To answer is like, if we have severe psoriasis and we will deliver a high energy, what is the risk of hyperpigmentation, or it's easy to get erythema?
As I said, this is from your practice. You will see that if you depend on the MED, you will not have this big erythema, the minimal erythema dose. Then with the practice, you know that even if the erythema happens, actually it has a good side in this, but the hyperpigmentation, the chance of hyperpigmentation is very minimal if you go through the minimal erythema dose. And then increase every session, you increase the dose. So okay. Don't worry with the psoriasis. Don't worry.
Okay. So some.
By the way, sorry, Ibrahim. By the way, the post-inflammatory hyperpigmentation, which happens with the excimer light, it's very, very simple. Not like the other laser. Actually, if happened with you, it will disappear in a few days. Don't worry.
Okay. I think that all the participants would like to know what are the precautions we need to take after an Excimer session or after Exciplex treatment?
Actually, the precaution is very minimal. That I told my patient in the first session not to have sun exposure, direct sun exposure directly after the session, as any session we are doing. Don't rub your skin. Don't get a cleanser or detergent on this in the skin. The usual precautions for our treatment, but there is no very hard precautions with Excimer light because it's very simple.
Okay. Can we combine Exciplex and UVB?
With UVB?
Yeah, it's like if you have.
I know. For me, I don't make this combination. For me, I am satisfied with the Excimer light only. You can take it from financially for time consumption, whatever. But for me, I take my result was by the Excimer light or its combination with other treatment, but not UVB.
Okay. Well, we have one question is up to you if you will answer it, is about some doctors are asking how do you charge, or how do you charge by for the sessions? Is it by shot or is it by session?
Okay.
What is the price or cost?
I will tell you, usually it's according to the space, the area itself, okay? Small area, medium area, large area, like that, okay? So it's according to the space. You can charge your patient. So this is actually different from doctor to doctor, but I think the usual way is
by space. Okay.
By space, yes, by the size.
Is it okay for large area to use Exciplex? It doesn't take a lot of time for one session?
No, it doesn't take, because Exciplex has a large, very good and large spot size. Actually, it doesn't take time for me. Even if it's like large area, I don't have session more than 10 minutes.
10 minutes, even if it's large area?
Yes, even it's large area.
Okay, just to give an example also for participant to treat a vitiligo case for the chest, for example, to cover all the chest, it will take less than 5 minutes, because the shot of vitiligo is around 4 seconds maximum, 4 to 5 seconds. So one shot is 4 to 5 seconds. That it depends on the area, how many shots we need to give. So that's how we calculate the time of the session, but it's very fast.
Yeah.
Okay, how much time after Excimer the patient can start to use or to take the topicals like tacrolimus or calcipotriol?
Okay, I give the tacrolimus at the same day as usual. It's okay. I start the other treatment from second day. But tacrolimus, I use it for the same day of the session. It's okay. When
okay.
They go.
So to make it clear for doctors, does the patient you take the tacrolimus just immediately before the session, or in the morning, then he come to the sessions, and at the night he takes the another?
In the same day of the session, you mean?
Yes.
No, in the same.
What is the
for me, my protocol, the patient will come not using anything, okay? And I will put the tacrolimus during the session, after the fractional laser or after the whatever I make. I make it in the same session. I put and I apply the tacrolimus. Then I will tell him to put it at night once more. Starting the next day, he will take the usual treatment.
Okay. Just I want to answer a question from Dr. Nadim about if we have small spots, how can we use large handpiece? Actually, it's about Exciplex is very small. We have different shape. We have reduction tips, so we adapt it to the affected area.
We have a very small shape. I use it for when we have hypopigmented areas, small areas. It's very small. You can target the area only.
Great. Another question was about the safety of Exciplex by using it on eyelid or genital area.
It's very, very safe. I am using it a lot around the pre-ocular area and eyelid and in genital area. And actually, it have a very fast response in these two areas. very good improvement, and it's very safe. We don't have any complication with it because it doesn't. It's absorbed only superficial. The second thing, these areas you adapt the dose according to our protocol. It will you will decrease. You will start in eyelid by. For me, I start with 80. Some doctors start with 50, but for me, I start with 80. It's very safe. Don't worry, nothing happened, no side effect, nothing. I have a lot of patients with genital area hypopigmented patches or vitiligo, and they have a very good result without any side effects.
Okay. Any experience of using minoxidil for vitiligo and how to use it if we use this combination?
No, I didn't. I didn't use this minoxidil for vitiligo. I didn't use it for vitiligo. He said.
Yes, for vitiligo.
No, I'm not using minoxidil for vitiligo.
Okay. Can we do microneedling and Exciplex in the same session? And just to make it clear to all the participants, what is the protocols when you do this combination between laser CO2, Exciplex, and topical or microneedling?
We have two types of combination. Okay, Exciplex, you will do the session of Exciplex, then you will do the fractional laser, then you will apply the tacrolimus. This is the first type. Second type, you will do the Exciplex, then you will make microneedling, then you will apply the tacrolimus. This is the three steps in the combination. Light, then the fractional laser or microneedling, then you put the tacrolimus.
Okay, we have also questions about the skin graft for vitiligo. Do you use Exciplex, or do you have any experience with the skin graft and after it you use Exciplex to repigment?
I didn't use it actually for my patient because till now I didn't need it. I use Exciplex and I have the result. We can think about the skin graft in case of very resistant cases. No other choice. I will recommend it, and then I will start to see if I will use the Exciplex or with it or not. But till now I didn't have this experience with the skin graft.
Just to answer also about regarding these questions, there are several clinical studies showing the efficacy and the importance of using the Excimer after skin graft or to help the pigmentation.
Okay, it's very good.
Okay. Another questions which is about the 5-fluorouracil for vitiligo. Do you have any experience by using it, or what is your recommendation protocol for?
We use it before, but as I said, it give result. We can use it instead of the fractional laser or the microneedling. But still, I prefer to use the fractional laser more than the 5. It gives a very good result. Okay, but I prefer to use the fractional laser more than the 5-fluorouracil.
Okay, just to explain a little bit why we will use Excimer plus fractional laser. I mean, what is the role of fractional laser or the microneedling? Maybe some doctors are asking these questions and would like to hear from you.
Yes, actually, it very simply, it opens channels which lead the laser and the medicine to go very fast and absorb it more faster and give us more faster results. It opens channels that the laser will go inside.
Okay. Regarding the experience with 5-fluorouracil, we have some doctors using this product with this treatment combined with the microneedling, and actually they have also very good results.
Yes.
Here we are exposing all the protocols that we recommend, and then of course each doctor prefer a protocol, and he can use the protocol that he thinks or he believes that is the best for every and each case of vitiligo, because each case is different. We cannot compare actually all the cases of vitiligo. So we have Dr. Fuad. Maybe some doctors didn't understand well. So the question is, you prefer Excimer in resistant cases only, or from beginning?
No, from the beginning.
From the
From
beginning.
the beginning, yes. I will choose to make a combination or not according to the resistance.
Okay.
But from the beginning, I start with the Excimer line.
Okay. We have also, actually, I have another questions regarding the treatment of Excimer with children. How, as your experience, how did Exciplex treatment changed the life of those patients?
A lot, actually, a lot. You know that this autoimmune disease, especially as I told you, vitiligo, it make a psychological disturbance for the children, especially in school. I have a lot of stories from their parents, especially if come in their face. This has changed a lot in my life. I'm dealing with the children. It give me the choice to tell the parent that it's okay, we will have results, it will disappear, inshallah. And actually, some parents told me that they told me, they begging me to take the photos of their children to put it in my presentation anywhere in the world, to see that there is a result, there is a solution. Because these parents come to me after they go to a lot of doctors. They tell them no hope. It's okay. You must accept this for your child, and then they see the improvement changes a lot with my dealing with children, especially. I
Uh,
have uh, I have one patient. She has in her genitalia and in her neck vitiligo lesions. She is 2.5 years old. 2.5 years old, and
okay.
her mom. You can see. You can imagine what the psychological disturbance her mom has. Now this girl is totally don't have any white patches. Totally in her genitalia and in her back of the neck.
Okay, and I can believe that in some countries, this disease, this condition actually is more psychological conditions, social conditions. So we are bringing this new solution, this solution for children, which is very safe and painless. Because, for example, in alopecia areata, we know the injections that it's painful. Here we are offering solution that
We are
very
playing
safe
with
and
the children here while we are doing the session. We are playing with them because it's no pain, nothing.
great. We have also another questions regarding the protocols. What do you recommend to use just before Excimer? Paraffin or any moisturizer,
No,
anything to reduce the visible scase or enhance penetration?
no. For me, no. Just they are taking their treatment as usual, but in the same day of the session, I'm not using anything actually.
Okay, and also it is a recommendation that from our company and from our experience with several doctors, and actually before the session of Exciplex, the skin should be very dry. Is a must. It should be dry
Yes,
because otherwise the cream has water inside and the water will block the penetration of the photons. So for that reason, the skin must be dry. No use to any sunscreen, no use to any cream before the sessions. We clean the patch and we start the treatment.
exactly.
Uh, Okay, we have also, in this particular case, where the 2 years child in the neck, what was your Exciplex protocol?
My Exciplex, I think we start with it's only Exciplex, by the way. I didn't make any combination for anything. I think I started with 80, okay?
Mm-hmm.
Then I increased till 120 and it disappeared totally in her neck. In her genital area, I started with 60. Then maximally I reach 100 and also it disappeared totally. I'm not making any session now in her genitalia. It disappeared
Just
totally.
to be clear, how many sessions? it took?
No, I think it's like maybe 10 sessions, and
10
this is
sessions, 2 times a week?
uh, once per week.
One.
I started the first week twice per week. Then the next week I feel that it started to repigment, so I told her, because she's young, make it once per week.
Okay. Is it safe for pregnancy and breastfeeding women?
Listen, it's not actually a pregnancy. We go away from pregnancy. Lactating, it's okay, no problem with lactation. For pregnancy, I know it is safe, but I'm not doing for the pregnant woman. No.
And we agree with you, because one of contraindication of Exciplex and Excimer Light is to use it in pregnancy. So we don't recommend to use Excimer in pregnancy. Do you use eye shields while treating upper eyelids? Any protection for eyes?
Yes, with the device, with the Exciplex itself, they have some shields. It has the different shapes. You are using it to minimize the area which will take the light, and because it has different shapes, I'm using it before I make the session. Yes.
Okay. What is a percentage of patients that respond to Exciplex? All your patients had results?
Till now, it's all my patients 100%. The difference is only how many sessions they will take, and how long they will take. Yani, it's only different from case to case according to how many sessions they will take. But
Okay.
thank God, it all respond. Thank God.
Okay, and one more questions from me, because some of doctors are asking these questions and always have this doubt about the relapse and the remission, the recurrence in case of psoriasis, in case of vitiligo, and in case of alopecia areata. What is your experience with this question?
Okay. For my experience, for vitiligo and alopecia areata, I didn't have relapse till now. 2 years now, I am using Exciplex. No relapse happened, especially because you are making maintenance. You are seeing the patient every 2, 3 weeks, 3 months. So you are following up. In psoriasis, there after like yani 1 year, I can see some relapse, not a whole relapse, some relapse in one batch, in very small area, not whole relapse for the whole lesion, but can be one batch. It can have some scale. So it decrease, even the relapse decrease in number, in size, and in severity.
Okay.
But this is psoriasis, and it happened in maybe one patient only, or two patients.
Okay. So last questions for today is, what is your maintenance protocol?
My maintenance protocol, when I take the final results I want, I start to make withdrawal for sessions. I increase the interval between the sessions. If I make 2 sessions per week, it will be 1 session per week, 1 session per 2 weeks, then 1 session per 1 month, then 1 session per every 2 months. I will see the patient every 2 months till 1 year, then every 6 months later on.
Okay. So I think that we had a lot of questions, and I hope that we answered all the questions of doctors that they are hesitating, or they have some doubt about using Excimer in their practice. So Dr. Amira, I want to thank you on behalf of Clarteis to be here with us and to share your experience. The presentation was great, actually. We enjoyed it, and I hope that everyone, also all the participants, enjoyed this presentation. And of course, any questions needed, or any information that all the participants needs, of course you can reach Clarteis, or you can reach the distributors in your countries, and we would be very happy to answer all your questions. Thank you so much for your participation, and of course a recorded version will be soon available. I hope that in a few days, so you can also watch it again. And if you have more questions, don't hesitate to contact us. Thank you so much.